Med-Surg Chapter 59. The liver is a complex organ and the terminology can feel overwhelming. In this video, I break down the essential key terms you need to know for hepatic disorders. I don't just read the definition, I explain why those terms matter and connect them to pathophysiology of conditions like hepatitis, cirrhosis, liver failure. In this video, we cover anatomy and physiology, understanding the hepatocytes and the portal vein. Signs and symptoms that what are the Ascites, Asterixis, Jaundice, Icterus, and Pruritus. Critical condition explaining hepatic encephalopathy, esophageal varices, and portal hypertension. Treatments like what is the TIPS procedure or Sengstaken-Blakemore tube. Hey everyone, welcome back. So today we're diving into chapter 59. Ever open a Med-Surg chapter, see all the bold terms and feel lost before reading the first line? Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Term 1. Ascites. The simple definition, this is just a fancy word for fluid building up in the abdomen, making it swell up like a balloon. Why does this happen? Your liver has an essential job for making a protein called albumin. Think of albumin like a sponge inside your body vessels. It holds onto fluid and keeps it from leaking out. When the liver is sick, it cannot make enough albumin. No sponge means the fluid can't stay in the vessel. It leaks out and fills up the space in the abdomen, the peritoneal cavity. This causes bloating, pain, and increased abdominal grief. So for the NCLEX tip, what's your big nursing priority here? All that fluid pushes up on the diaphragm, which can cause shortness of breath. SOB, we call it. So you need to monitor the respiratory status closely and measure that abdominal grief daily to see if the fluid is increasing. Next is a big mouthful, hepatic encephalopathy. You see, hepatic encephalopathy. The simple definition, this is when a patient gets confused or has a change in their mental status because toxins are building up in their brain. The word tells you exactly what it is. Hepatic means liver. Encephalo means the brain. And pathy means a disease or disorders. So it's a brain disorder caused by a liver problem. Normally, your healthy liver detoxifies your blood. It takes waste products, especially ammonia, which comes from breaking down protein, and get rid of them. A sick liver cannot do this job. The ammonia builds up in the blood, travels to the brain, and acts like a poison, causing confusion, sleepiness, and other mental changes. NCLEX tip, what are you watching for? Look for changes in their level of consciousness, confusion, or agitation. A classic sign is called Asterixis, which is a flapping tremor of the hands when they hold their arms out straight. You will often see those patients giving a medication called lactulose, which helps them poop out that excess ammonia. Anatomy, liver and hepatocytes. So the keyword is this hepatocytes. It's included in anatomy of this chapter. It's like a body parts. So hepatocytes is a liver cells, main liver cells for so the main liver cells for it's good for metabolism, detoxification, and bile production. So from that long list of key terms we have at the beginning of the chapter, I selected those here for liver disease signs and symptoms. So we go alphabetically one by one. So signs and symptoms, what you see or what the patient feels. So the first one, as you see here, it's Ascites, fluid accumulation in the peritoneal cavity, abdominal swallowing, and often due to portal hypertension from cirrhosis. The next is Asterixis, a flabby tumor I said earlier of the hand when the wrist is extended. Sign of hepatic encephalopathy, flapping tumor of the hand seen in hepatic encephalopathy from ammonia buildup, right? Next is ecchymosis. This we see also in skin disorder. Key term, it's the bruising, large skin discoloration. Most of in the nursing documentation you describe as skin discoloration, and you point the color. You don't just say bruising. Depends of the facility protocol. From bleeding under the skin to here. So the next one, epistaxis, the nosebleed, is very common to know, especially in pediatrics. Nosebleed as signs of coagulation, clotting problems. Nosebleed is possible in liver disease from coagulation defects. So the next one is the hepatomegaly. So it's the liver, megaly it's large, and means enlarged liver. So basically you can see during the examination, like exam or imaging. The hepatosplenomegaly means that hepa is liver, and then spleen and enlarged. So it's there both enlarged. Icterus, it's another term for jaundice, yellowing of the sclera, the white part of the eye. Yellow skin, here yellow skin, eyes from bilirum buildup. So the jaundice is the yellowish skin color caused by the liver inability to break down the bilirubin. The petechiae a small round, so this is better to say, small round spots on the skin caused by bleeding. So it's clotting issue. The pruritus, severe itching of the skin, often due to a bile salt buildup. So it's a small red purple skin spot from low platelets. Then the splenomegaly, so it's only the spleen here, large. So it's enlarged spleen, often from portal hypertension. Here for the signs and symptoms is the last one, it's urticaria, so it's pale, red, raised bumps on the skin, so hives, raised itchy welts from allergic reaction or liver disease. Here we have the liver pathophysiology and diseases, condition and pathophysiology. So here are the key terms that I thought, and to make it in one image. So the first one, it's here the cholangitis. So we know this is some inflammation. Inflammation of the common bile duct. The bile ducts, usually from bacterial infection or obstruction. Then the next one, it's cholestasis. It's a blockage of a bile flow, reduce or stop bile flow, causing jaundice and itching. Then we have the cirrhosis, chronic liver disease characterized by inflammation, and it is irreversible scarring. So it's chronic irreversible scarring of the liver that impairs its function. Then we have this, the DIC means the disseminated intravascular coagulation, which is a serious condition causing abnormal blood clotting and excessive bleeding. Widespread clotting and bleeding can occur in severe liver disease. The next, we have the esophageal varices. So it's like abnormally dilated and wicked veins in the esophagus caused by portal hypertension. Dilated veins in the esophagus, right? Because that's why I say esophageal. So it's caused by portal hypertension, prone to bleeding. The next one has to be H. So it's this one, hemochromatosis, a condition of excess iron buildup in the body liver. Iron overall disorders causing liver and other organ damage. The hepatic encephalopathy. It's impaired mental status, confusion, coma due to a toxin build-up, which is an ammonia in the brain. Brain dysfunction from toxics like ammonia due to liver failure. Then the next one is hepatitis, which is inflammation of the liver caused by viruses, toxins, or autoimmune disorders, right? It's inflammation. Next one, let's see. So the next one, let's see, hepatorenal syndrome. This one. Rapid kidney failure occurring as a complication of liver failure. Kidney failure secondary to severe liver disease. Here it's loud neck cirrhosis, alcohol-induced cirrhosis with nodular scarring. You see here nodular and scarring. Then we have liver failure, severe inability of the liver to function, leading to life-threatening symptoms, severe loss of liver function, leading to multi-organ dysfunction. The portal, we have the portal hypertension. It's the increased pressure in the veins carrying blood through the liver, increased portal veins pressure, often from cirrhosis. Spontaneous bacterial peritonitis. This is the SBP, so it's spontaneous bacterial peritonitis. So it's a bacterial infection of the acidic fluid in the abdomen. Injection of acidic fluid without clear source in cirrhosis. I found 3 key terms related to labs and diagnostics for the liver tests and results. So the alpha fetoprotein, a protein marker used to screen for liver cancer, a protein produced by the fetal liver, elevated in adults may indicate liver cancer or germ cell tumors. The cologeography, so the you see colo, so it's the dark, and then the path, and the graphy, it's the photo. So diagnostic test like X-ray used to visualize the bile ducts. So this radiologic imaging of the bile ducts to detect blockage or abnormalities. The last one, we have the thrombocytopenia. So this is like, as I said, like a result. So a lab. Here it's low platelets because it's pneumonia. It means low. And low platelets count less than 150,000 millimeter cubes, which increases bleeding risk. Low platelets often from splenic sequestration in the portal hypertension. In that list of key terms, I found medical treatments as a key terms and procedure. So I found like sclerotherapy, a procedure where a solution is injected into bleeding varices, so here, and to make them shrink and stop bleeding. The injection solution in varices to stop the bleeding. Then here this tube, but also there are 3 types of tubes. You will find some crash carts in ER, they have these, or they have 2 here, like there are 3 types of this. So the Sengstaken-Blakemore tube, a tube inserted into the stomach esophagus to stop bleeding from varices by applying pressure, balloon tamponade. So the balloon device is to control esophageal variceal bleeding. From that long list, I found this keyword as a surgery. So it's transjugular, intrahepatic, portosystemic shunt. Surgical procedure to place a shunt, the tube, between the portal, and systemic veins to reduce pressure and fluid buildup. So the fluid build-up is the ascites. And this shunt between portal and hepatic veins to lower portal pressure. So you see, when you understand the liver job as a filter, those big terms starts to make a lot of more sense. Ascites is the fluid leaking because the sponge it's gone, and hepatic encephalopathy, it's a foggy brain from a clotted filter. Here is the list in case you want it as a flashcard. I hope this helped unclog chapter 59 for you. If it did, give this video a thumbs up and subscribe for more Med-Surg, Med-Simple. Thank you for watching and happy studying. See you in the outline for all those 4 disorders in more detail. Bye for now.